1,266. We are reporting no additional deaths, so the total number of deaths to date remains at 1,753. The median age of all who've died to date is 83 years, 864 in males and 889 in females, and 94% had underlying medical conditions. Over the past 14 days, 270 cases have been notified, of which 211 have actually arisen during that period. If we take the 270 cases that have been notified, we get a 14-day incidence of 5.67 per 100,000 population. Of these 270 cases, the median age was 34 years and 69% were less than 45 years of age. 115 cases were in males and 154 cases were in females. 83 cases, or 31%, were in healthcare workers. And 149, or 55% of cases, were in Dublin, with 28, or 10% in Kildare, and 15, or 6% in Cork. The remaining 78 cases were spread across 17 counties. In relation to clusters, there have now been a total of 470 in all residential care facilities, of which 267 have been in nursing homes. These clusters have been associated with 7,486 confirmed cases across all residential care facilities, of which 5,868 have been in nursing homes. There have now been 1,110 deaths associated with outbreaks in residential care facilities. That's 63% of all deaths. And of those, 987, or 56% of all deaths, have been associated with clusters in nursing homes. And just to finish, there are currently 11 confirmed cases in our hospitals, 9 of whom are confirmed cases currently in critical care units. So first of all, this evening, I'm going to hand over to Rachel Kenna, who's our Chief Nursing Officer here at the Department of Health, and then we'll hand over to Dr. Sumi Dunn, who's a general practitioner and who'll also provide some information in relation to her experience to date with COVID.
Thanks, Ronan. I suppose it's just an important subject to talk about, the fact that our healthcare workers have been on the front line since the beginning of this global pandemic and dealing with the public health emergency here in Ireland. They have seen firsthand the terrible effects that this disease can have on people who are positive for COVID-19. It has been a very difficult time, and I think probably we have a lot of evidence now that it has been a demanding time physically, emotionally and psychologically for all of our healthcare workers. There's a lot of anxiety and worry when they're trying to provide care for a new disease, and on top of that, trying to provide care for the variety of illnesses that they do on a normal day-to-day basis. They're doing that with an increased level of death and providing extreme end-of-life care when loved ones and family can't be with patients, and that does take its toll. This is work that they do all of the time, but the rate and the volume of this work is obviously increased with COVID-19, and that will have its effect. So I suppose just in terms of trying to help them and look after themselves on the front line with the anxiety around their own health. They've had to look after their own colleagues. They've had to look after some of their own colleagues who have been very, very ill. And they've also had to do this when they're worried about their own family members, their own loved ones at home. So it has been a very, very difficult time. So if the public are wondering what they can do to help as we face into the winter, is that we can continue to follow the public health advice and to try and to help to keep the COVID-19 virus at bay. So hand washing, face coverings on public transport, in shops, to maintain physical distancing 2 meters, to avoid crowds where possible. Outside we know is better. And to just observe etiquette, coughing and sneezing, you sneeze into your elbow. All of these things will make a difference to try and help our healthcare workers to deal with what is coming. They are tired, they're not ready for another 4 months like we've just come through. So again, just to ask the public to do their bit, and if everybody plays their part, it will help us to be able to deal with what's coming.
Thanks, Rachel. And Sumi?
As we know, COVID-19 is highly infectious, but it needs to come into contact, into groups, into communities, into social networks, into crowded spaces. So if you are congregating in groups, if you're in enclosed spaces with no ventilation for long durations of time, these are all risk factors, and we're trying to reduce this as much as possible. Within general practice now, we are seeing increasing numbers coming again into our surgeries. We are referring more and more people for testing. There is no blame for coming forward to be tested. And I iterate this again, there is absolutely no blame. We are not interested in how you may have picked up the virus. What we are interested in is getting you looked after, making sure that you are isolating, that you are calling your GP, and that we are arranging testing for you as quickly as possible. That is our main key message here. Please come forward quickly so that we can arrange testing for you. To reduce your risk, try and keep the number of people that you're meeting at home or in other households as small as possible, as recommended, to a number of 10. Try and meet outdoors, meet little and often. Keep your social circle small, keep it tight. We're not saying don't meet your friends, we're just saying to be aware around it. Remind yourselves again of the symptoms. These will be really important if you are feeling unwell. If you have a new onset of a high temperature, if you have a cough of any description, if you feel short of breath, if you feel that you have had a change in your taste or your smell, you need to come forward and notify your GP so that, again, we can arrange testing for you. In the interim process, while testing is being arranged, we would advise that you do isolate and restrict movements to any other members of your household for that.
Thank you. And so now we'll take some questions.
Zara King, Virgin Media News. Good evening. First of all, Dr. Glynn, I suppose people might say, oh, there's only 6 new cases today, but would you put this down to being a Monday? There's usually a lag in reporting.
So we can often see a lag, particularly in relation to the notification of deaths after a weekend. But yes, given the numbers we've seen day to day over the last 10 days, I'd expect to see an increased number again tomorrow, unfortunately.
Okay. I suppose a lot of people will have seen on their own social media feeds, maybe people congregating over the weekend, and perhaps people maybe doing the right thing, social distancing for the most part, and then you'll often see that there'll be a group photograph at the end of the night where everyone piles in together for that group photo and they've done the right thing all evening, and then in this one moment they've sort of forgotten themselves. Can you speak to that? I mean, is that obviously people shouldn't be wrapping themselves around one another in photographs? Is that fair to say?
Yeah, I mean, I think in fairness, I was out and about myself at the weekend, and what you see is that the vast majority of people are making a real effort. They're wearing face coverings. You see them sanitizing their hands. But the one piece I think that possibly people are forgetting about, and it's quite easy to forget about it when you're in social settings, is the distance. So if possible, stay 2 meters away from other people, or at least 1 meter away. It does make a difference, and that includes outdoor settings. So yes, outdoors are safer than indoors, but even when you're outdoors, if you're in the park, if you're meeting up with your friends, which we're encouraging you to do so, but try to do so safely and keep that little bit of distance.
Yeah. Dr. Dunn, you were speaking there about there being no blame for coming forward. Are you starting to see a bit of a stigma emerging as time goes on?
I think people are worried, and I think they do feel that they'll be judged. Certainly that's not our role in general practice at all. We're very keen to identify people so that we can get them tested, that they're isolating appropriately in order that then contact tracing can be carried out. Together with this, we're recommending that as many people as possible use the COVID tracking app, which is downloadable. So with both coming forward, using the tracking app, and not having any fear of judgment, I think that's a very important message that we need to get out to people.
Yeah. And Dr. Glynn, does NPHET have reason to believe that stigma is now stopping people from coming forward?
Not other than anecdotal reports from our GP community, but we take those reports seriously, and invariably what we find is that what the GPs tell us is happening on the ground tends to play out in real terms a week, 2 weeks later. And I'm always conscious when I'm sitting here in the evening and giving the public health messages and telling people that we want them to do X, Y, and Z, and there's questions about clusters and house parties. We're giving that information to people and we're asking people where possible to protect themselves and others. But this disease is really infectious. even if you take all of the precautions, you can still be unlucky and contract this disease. There will be absolutely no judgment of anybody who contracts this disease. There never has been, and there won't be. The important thing is, if you've got any symptoms, to please come forward. Your GP will treat you confidentially, in the strictest confidence, and will make sure that you, and just as importantly, that if you do have it, they'll ensure that your family are followed up appropriately and your loved ones, so that if they need to be tested or informed or cared for, they can be in the most appropriate ways.
And you're speaking tonight in the press release about a range of outbreaks in work settings, particularly in construction and fast food outlets and supermarkets. And you're saying that we can't underestimate how quickly clusters develop. Perhaps you might just like to speak to that and tell us a bit more about how quickly these can develop.
So again, we know this is an extremely infectious disease. I'm sure people saw the reports of the outbreak in, I think it was Limavady last week. It does not take much at all for this to spread. It can spread through contact, or it can spread just by being in close proximity to someone who's unwell. So I suppose the message this evening is to employers in the first instance to look again at your protocols, look again at the return to work safely protocol. I know that when businesses reopened a number of weeks ago, they obviously went to great lengths to protect their employees, their customers. It's understandable if that compliance and that adherence has dropped off over time. I guess what I'm saying now is that now is the time to look again, ramp up your measures again, and ensure that your employees and your customers are being kept as safe as possible. And
last week, Dr. De Gascon was speaking on radio about the possibility that we might find ourselves having to move back to phase 2 if numbers continue to rise. Is that something that NPHET has discussed and considered?
So we've always been honest that this isn't a one-way street with this disease. We have moved progressively in a better direction over the past number of months, and albeit we had to take a pause a number of days ago, we're still in a good position. We would hope to be able to take a much more nuanced approach over the coming weeks and months where we see problems. But to be able to do that, it's contingent on our public health teams around the country being able to respond really quickly and really robustly to any cases or clusters that arise. And for that to happen, we have to ensure that there's not too many cases or clusters arising at once, and we need people to come forward quickly if they've got symptoms, to self-identify and come forward so that we can protect them and stop any chains of transmission that may have resulted from their case.
So you're not ruling out the possibility of going back to phase 2, is that what you're saying?
So we're seeing what's happening internationally. We had over 250,000 cases reported globally on Saturday. We're in a very good position here versus the vast majority of the rest of the world. Of course, our intention is to remain in that good position. We don't want to go backwards, but we can't rule it out, unfortunately. And ultimately, the power to prevent that is in all our hands, and we've got to keep taking that each day at an individual level. We have choices to make, and tough and all, and unfair as it all is, each of us individually need to keep making those choices and protecting ourselves over the coming weeks.
Thank you.
Hi, Ron. Shane Beattie from News Talk. Your survey tonight says that 75% of people surveyed think that there's going to be a second wave. So obviously people are worried. What do you say to them when so many people assume that there will be a second wave? Are they right to assume that? Or does it surprise you that 3/4 of people think that this country is going to have a second wave?
It's certainly not surprising when you see what we see on our TVs every night about what's happening around the world. As I've just said, we can't rule out a second wave here in this country. We can't rule out an increase in cases. All we can do is respond quickly, robustly, decisively where we see an issue arising. And I said a key part of that is our own individual actions all of the time. Of course, as NPHET, we will respond quickly if we're concerned, and we'll communicate that concern quickly. But at an individual, ultimately, this comes down to individual action. We have a real opportunity, as I've said over the past number of weeks, we have a real opportunity in this country to continue functioning in what relative to many parts of the world is a relatively normal society. Where we've got back to is, relatively speaking, a good place It's not where we were last January. It's not where we want to be. But relatively speaking, we're in a good place. But to maintain that, we need to keep the disease where it is right now.
The travel green list is due later in this week. It was due today. There's lots of talk still, lots of debate about it. Is there a final message that NPHET would like to get out about your position on the green list? Now that we've had all of this talk and we are getting the list, is there something else that you want to say about the green list and what we can expect from it?
I'm not sure that I or NPHET can be any more explicit than we've been over the past number of weeks. The pandemic is accelerating globally. The world is not in a good place in relation to this pandemic. We are in a good place here in this country. The more movement there is of people, the higher the likelihood of an issue arising again in this country. And that includes movement within the country. But as I've said, from a doctor's perspective, from a public health perspective, from the perspective of our healthcare workers all around the country who are exhausted, we're asking people for this year not to travel abroad.
And given what we've seen, the recent increase in cases, would public health doctors be happier now this week if the list wasn't published?
So from a pure public health perspective, like the best thing that could happen from a disease perspective is that you shut down the country and don't let anybody in or out. And if we thought that we'd have a vaccine in 10 days' time, that might be a plausible approach. But people still have to live. There are many reasons why people still have to come and go between countries. So from like the decisions that are made by government have to be pragmatic. We have to live with this disease, and crucially, we need to keep people with us on this journey. We won't have a vaccine next week. So far, the vast majority of the population in Ireland have stuck with us. They've done every single thing that we've asked. And I know that we see anecdotal stories of things not being done as we would like, but the vast majority of people clearly are sticking with the advice, and that's why we're in such a good position. Like if I suppose from our perspective, shutting down the country is neither a pragmatic nor a plausible solution. So I'm sure that the measures that government bring forward next week or tomorrow or the next day will be pragmatic and will take NPHET's advice on board.
And for the fact that you gave the figures there, 21% of cases in the last 2 weeks are travel related, would it not be better if we didn't have a green list published later this week where people go, oh, I might go to Malta, I might go to Greece or wherever could be on the list? Would it not be better, because of 21% cases related to travel, would it not be better if we didn't have a list published later this week?
So the list, as I understand it, that will be published will have a very small number of countries that have a similar or better epidemiological profile than we do here. And from that perspective, from a purely epidemiological perspective, there shouldn't be an increased risk in terms of what happens in those countries. And that's a different thing from what individuals do here or what individuals do there, or the risks they take from getting from here to there. Just in relation to the travel-related cases, the vast majority of those cases arose in this country as a result of interactions between people in this country. And so it's very important that people don't get the wrong impression and think, well, you know, this disease is now being entirely driven by people coming into this country. That's not the case. The vast majority of cases that we're seeing every day are arising because of interaction between people in Ireland. And so it's really to reiterate the messages again, that if you want to protect yourself and others in this country, follow the public health advice in this country.
Okay, just one final one from me. We had one pub that opened today down in Limerick, and he said he wanted to do it to show that he can open safely, that he can have social distancing. What do you say to those pub owners who are just thinking to themselves, we can open safely, we're safer than some of the places that are actually open at the moment, and they can't understand the rationale that just because they don't serve food for €9, that they can't be safe in what they're doing?
I fully understand the frustration that pub owners have. I mean, it's a terrible position that they're in. But we have clear evidence internationally that pubs are one of the highest risk environments for this disease and for spread of this disease. I didn't see the report on the pub that's opened, but clearly we've said from an NPHET's perspective, the only businesses that should be open are those that are serving food, and serving food in the manner that we would traditionally recognise as a restaurant in this country, not in the manner that we here in Ireland traditionally recognise as a pub. Thanks.
Sean Murray from the journal.ie. Just to touch on what Shane was saying about the green list again, you were saying that when that list is eventually published, there'll be a very, very small number of countries that are all quite similar to us. A couple of weeks ago, you said that that situation in other countries is changing rapidly. Is it the case where the eventual list that may be published might have been slightly larger a few weeks ago, and the situation has worsened in other countries? So will that be a concern going forward, then, that if these countries are okay now and people book, even though they shouldn't, that's not your advice, but if people see this green list and book, say, and then things worsen very, very rapidly over there, is that a concern?
It is. So just to come back, first of all, I didn't say that there would be a small number of countries, just to be clear. I'm assuming that it'll be a small number of countries given our own epidemiological situation, but the list is a matter for government rather than myself. Yes, I mean, I think the government, in fairness, has been clear that the list will be reviewed every 2 weeks. And the reason it'll be reviewed every 2 weeks is because the epidemiology of the disease is changing quite quickly across the world. And so a country that's safe today may not be safe from an epidemiological perspective in 2 weeks' time.
Yep. And on the app, it launched 2 weeks ago, and it had quite a large take-up initially. People downloaded it in the millions, over a million. It's 1.3 million now. Can you comment on if that is enough people who've signed up so far, or do we need a larger take-up for it to be as successful as you guys want it to be? And have we seen it in practice be useful in helping to contact trace for confirmed cases as of yet?
Yeah, so obviously the more people who participate by downloading the app, the better. And in fact, we found that it added to our contact tracing within 2 days of it being launched, where there were additional people traced by using the app information as opposed to through the traditional questioning and following up by phone method. So it's a really good app. It's very compliant with GDPR. All of a person's information is stored on the phone. That information is only used with the express permission of the phone owner, and the contact individuals that are stored within the phone are communicated to directly by the phone. So the phone owner never knows the individuals who are contacted. So a person's privacy is maintained throughout. It's very simple, very easy to use and highly effective. And I have to say, I report my symptom status on a daily basis, as does all my family and colleagues.
Just in terms of take-up then, obviously you had like a large number signing up at first. Like, do you think that we still need a substantial proportion of the population to sign up for it to be where you want it to be?
Well, it's useful within our existing percentage, but of course we would like to have a higher number of people signing up. The more people who sign up, the more effective it will be in contact tracing. Absolutely.
And obviously we're so far away from a vaccine, but there was a positive study published from Oxford today saying that it was safe and it provoked an immune response in a phase 1 trial, which is obviously, as again, far away from being a reality. But I kind of initially get your reaction to that, and then also if far into the future we are in a situation where there's a safe, efficacious vaccine that gets all the regulatory approvals, what kind of barriers or what kind of steps do we need to take to make sure that we can get a large volume of these doses in bulk? So, firstly, of course, I welcome the positive results coming out of that particular work. And I think just to reiterate or reassure people that we have seen a level of research around COVID generally, and then work specifically around new therapeutics and new vaccines around COVID. It's on an unprecedented scale. We have never seen so much happening so quickly in relation to a disease. It's unprecedented in medicine. So I would be hopeful that we will have therapeutics and that we will have a vaccine, and hopefully it won't be years away. I know I've given caveats previously, and I know, the
typically, it takes 5 to 10 years to develop a vaccine at a minimum. But as I said, given the global effort that's ongoing at the moment, we would hope that we'll have something much sooner than that. In relation to your specific question from Ireland's perspective, we have been part of, there's been many European partnership components to the response to COVID, and one of those is around manufacture and procurement of a vaccine or vaccines. And so we've been engaged with European counterparts in that for quite a number of weeks now.
And so you'd be happy that there won't be any kind of barriers to us getting one when there is one available?
So I think when a vaccine or vaccines are developed, they'll need to be manufactured, again, on an unprecedented scale. The entire world will want these once they're available. So from our perspective, the best way we can assure supply is to partner at a European level with all European member states and ensure that we're approaching it as one and procuring as one. And so that's the approach we're taking.
Cheers. Thanks, guys.
Hi, Dr. Lynn. Simon Carswell with the Irish Times. You made reference in your statement to the number of outbreaks of the virus in work settings, construction, fast food outlets and supermarkets. Just wanted to ask you about some more details on that. How many outbreaks have you seen in construction?
So and I know it's been reported, there's one particular outbreak in a construction site in Dublin city centre at the moment that's had over 20 cases to date, and a number of other workers on the site have been tested, so they'll be waiting results. So that's the first significant cluster on a construction site that we've had to date. But clearly, I wanted to use it just as a message to employers, not just in construction, but employers across industry more generally, to once again go back and look at the return to work safety protocol, make sure everything that you need to do is being done.
And you mentioned fast food outlets. How many outbreaks in fast food outlets? So
there's been a couple around the country. There was one in particular in Kildare, but that's been managed and we haven't had a case linked to that now for a number of days.
So when you say cluster, it's 2. You found 2 cases in that? Or?
No. And I'm not going to give the specific cases linked to a particular cluster. But there was a significant number of cases linked with that. But what I'm saying is it's more or less closed off. We haven't had a new case associated with that particular cluster for about a week now.
And supermarkets, how many supermarkets are there outbreaks in?
So again, there's been a number of outbreaks associated with retail settings around the country. I don't have a specific number, and many of them would be managed locally by the local public health teams, and they wouldn't necessarily be big clusters. There might be 3, 4, 5 people, no bigger than what you would see in a private household. But I guess the message I'm trying to get across is that this disease doesn't stop at the door of your house. It doesn't stop at the door of a hospital or a healthcare setting. It's out there. You need to take all of the precautions that you should be taking in your workplace.
And just in relation to the 3 construction fast food outlets, supermarkets, any hospitalisations out of those clusters?
So I'm not aware of hospitalisations in relation to the first 2, and the construction site it's only been notified in the last couple of days. So I'm not aware specifically. As I said, we need to be careful what information we give in relation to specific clusters, I guess. But it is important to get. I know there's information out there that cluster has happened, and I really want to use it just as a signal to employers to look again at what you and your staff are doing and make sure it's up to standard.
And just in the initial findings that you've looked at from the public health teams and all those 3 categories, have you seen any lapses in social distancing, in measures, public health measures that weren't being enforced, lapses in kind of safety in terms of workplace?
No, and I wouldn't have that detail unless there was a very particular issue. I wouldn't receive that detail. But I mean, we've seen anecdotally, and I'm not referring to those workplaces. I have no detail on those workplaces, but we've seen anecdotally. If you walk down the street, you will see people who maybe aren't doing everything they should be doing. And again, I'm referring particularly to face coverings in retail, face coverings in public transport, and in particular, physical distancing. Workers need to physically distance. You're no safer because you're in a work environment versus any other environment. So if you're too close to one of your co-workers and you've got the disease or they've got the disease, and they could be completely well and be giving you the disease. So just because they seem well and just because they feel well does not mean that they cannot give you the disease, which is why it's so important to keep the 2 meters.
Given the increase in cases globally, that you referred to 250,000 cases globally on Saturday alone, Is the idea of publishing a green list of so-called safe countries to travel to, from a public health perspective, is that a good idea right now?
So I think from a public health perspective, and again, I fully understand the focus and the concentration that's on the green list. To be perfectly honest, what we're much more concerned about is the 190 or whatever number of countries that will not be on that green list, and ensuring that people from those countries know that whilst in all normal times they're very, very welcome to this country, right now, unless it's essential travel, we would really prefer if you didn't come to this country, given what's happening internationally.
Dr. Holohan mentioned before, he talked about anticipatory behaviour and how it can dictate how people behave when they see something happening. Is the publication of a green list not extremely unhelpful when it comes to that kind of message it sends out? You here are telling the public not to take non-essential travel overseas, and here we have the government publishing a green list which says these are the list of countries that if you go to and come back, you don't have to self-isolate for 14 days.
So, I mean, I was clear last week that I do think the messaging is confusing and has been confusing. The value of a green list is that you can go there. Ideally, you only go there for essential travel from my perspective or from NEFIT's perspective. And that when you come back from that essential travel to those countries, you don't have to restrict your movements, because it's the same as going somewhere within this country from an epidemiological perspective. But overall, even with the green list, we'd prefer people not to be going there on their holidays. That's why we're unequivocal that for this year, green list or no green list, we do not want people going overseas on non-essential travel.
Just finally, are you happy with how contact tracing is operating right now? Are you happy that when you find a case or when we discover and confirm a case, that those contacts are being traced, those people are being contacted and pursued, as in terms of making sure phones are picked up, there's enough contact with those people to make sure they're aware of them being in contact with a confirmed case?
So with something like this, there is always room for improvement. So I'm never going to say that I'm satisfied, but certainly the vast majority of cases are getting identified and contact traced quickly, robustly and appropriately. But the key to continuing with that is that we keep case numbers low, because as Rachel said about our doctors and nurses in hospitals, our GPs, everybody is really tired, and at the centre of that are public health doctors who've been managing outbreaks in clusters for months now. They can continue to do that, and they will continue to do that. But the more clusters there are, the bigger the clusters they are, the harder it is for them to continue to do that robustly and quickly. So the biggest help that our public can give us right now, the biggest help that our healthcare workers can get right now, is for everybody to take individual responsibility and cut the chains of transmission. And let's get the cases back down to where they were a couple of weeks ago.
Very last question for me. Just some of the travel cases that are coming in from overseas. There's anecdotal evidence we're hearing that, Americans who would come in, they wouldn't have phones on, they wouldn't have roaming, they wouldn't be using their own phones, so it'd be very hard to trace particular cases. Is that something that's come up on your radar, or is it a cause of concern for you?
I've heard the anecdotal reports. I think the making the passenger locator form electronic and ensuring that we have the appropriate contact details will be a key part of addressing those concerns.
Thanks very much.
Hello. Good evening, Neil Leslie from the Mirror. Sorry, it's similar questions on the clusters there, but did you say? Sorry, you said the cluster in the building site. They're still awaiting some tests on that. All those cases haven't been counted for in the numbers we've got this evening. Then there's still some outstanding, are there?
Absolutely, yes. I think the cluster was identified at the end of last week initially, and then so people would have been tested. So all of those results, or some of those tests, would still be in process, so we'll probably have more of them fed into tomorrow on Wednesdays. You're
confident and happy that the process and the testing times are sufficient there to lock these things down as they're happening, and people can be confident that that's the case? Sure, and there's a full outbreak control team in place managing that. Okay, and just for the clusters, there hasn't been any in crash settings since the June 29th, has there? Or was
Not
there
that I'm aware of, no.
Is that something that gives encouragement going forward in relation to childcare and schools for you? Yeah, I mean, the majority of the evidence that we've seen to date gives us confidence, particularly in relation to younger children, both in terms of the impact of the disease on children themselves and then in relation to children's role in transmission of the disease. What we are seeing increasingly, though, is some evidence that older children, so teenagers, may have a similar transmission profile to younger adults and adults generally. So we need to monitor that.
But from our perspective, of course, it's very welcome that the evidence continues to build in the one direction, which is that younger children are both not impacted too severely from this disease in the main, and that they don't seem to play a role in transmission like they do in, for example, the seasonal flu.
And just to the frontline workers, you had a strong message there about how exhausted they are and not ready for yet another wave of this. Specifically to the travel question, would they have a message, or would you have a message on behalf of them for people who are considering travel in the light of this green list debate?
I think it's a very good question. I think they would plead with people to stick to the public health advice, and this year just stay at home. Don't go on holidays, don't travel unless it's absolutely essential, because we're just not ready. We're busy, we're still working every day, seeing all of our other patients. So we're not ready for another 4 months like we've just come through.
Good. And finally, just on there's some talk of, fears of a second wave, but from the GP's perspective, as often described as the canary down the mine, you're saying you're seeing more and more cases now. Do you feel like you're already in the second wave from your perspective?
From our perspective at the moment, I think we are getting enough people tested, and where people are isolating prior to leading up to testing. So we're not in the canary in the mine situation just yet. But if complacency starts to creep in, if people don't adhere to all the guidelines that we are advising, that NEFA are advising, then I think we are going to come to a situation where our second wave will probably come, or may come, quicker than we anticipated or would want. We're in a really good place at the moment. That has to be put out there, and we need to keep this very safe place in the community and in general practice. So again, we're urging anyone with any kind of symptoms, if you feel that you may have been exposed to the virus, to come forward quickly and to be tested.
Thank you.
Hi, Dan Grennan from the Irish Daily Mail. Excuse me. Dan Grennan from the Irish Daily Mail. I was just wondering, your release here references supermarkets, shops as the new front line. I was wondering, does NEFA anticipate a spike of cases from retail and those sectors?
So, very important, first of all, to say that retail in particular has done a fantastic job in relation to COVID-19. Like the number of clusters or cases associated with retail settings has been very small. And we can all see the measures that retailers, big and small, have put in to protect their staff and customers. So this is in no way an assessment of that effort. Do I expect to see more clusters associated with work settings? Yes, I do, because we've eased measures. There are more work settings. This evening, I'm just trying to take the opportunity to say, if you're in a work setting, you've probably been there for a number of weeks now, it's natural that you might relax in terms of what you're doing. You might assume that the risk has got smaller, and you don't need to keep washing your hands. You don't need to wear a face covering. You don't need to physically distance. The message is that you really do. And the virus is still out there, and the virus does not care that we've had success to date, and it's just waiting for an opportunity to spread again. So please, in each of your interactions, think about how to do it safely.
Okay, and then just in terms of supermarkets, I was wondering, was there any cases confirmed passed from staff onto customers?
Not that I'm aware of, but again, I'm not going to get into that level of detail.
All right, thanks.
Sorry, Ronan, Orla O'Donnell from RTE News. Just on what my colleague was saying there, people will hear supermarkets and freak out a little bit. Is it staff? Are you talking about staff members as passing it on to each other? Are you talking about customers, or what exactly are you talking about?
So there's been a small number of clusters amongst staff, yeah. We can't rule out the fact that a customer in a shop somewhere has picked it up from a staff member, but that's not my message this evening. It's that we have had groups of staff in different occupational settings. I mean, the meat processing facilities was very well publicised, but we have had other examples in other occupational settings. And I guess what I'm concerned about is that people go to work and they feel that they know their co-workers, they feel that they see them every day, and they drop their guard. And the reality is we don't know where a co-worker has been at the weekend. We don't know what other people are getting up to. We don't know what their family members are getting up to or where they have been. And the problem with this disease is that you can be standing there next to a co-worker who's perfectly well, and unfortunately, they can be transmitting the disease to you. So it's a message, again, just to take a step back, think about your own risk, think about your family and your loved ones, and just take the precautions.
And just finally, you talked there about maintaining where we are at the moment, this relatively normal position that we're in, not where we were in January. Is that the best we can hope for? Is there anything to be said for what some people are calling for trying to go further and crush it or suppress it even further? But is the best we can hope for the foreseeable future where we are now?
So when people talk about crush or suppress or eliminate, they mean get the numbers as low as possible. And that's precisely what we want to do. We want to get the numbers as low as possible and to keep them there. Even if we do get them as low as possible, the reality is that it can come back at any time. And that's the unfortunate reality of where we're at with this in the context of what's happening internationally. But by keeping it as low as possible, all of the things that have reopened, all of the activities that we can now do that we couldn't do in March and April, we can continue to do as long as we do them slightly differently and in a safer way than how we would have done them previously. So until we have a vaccine, until something changes about the virus, until we have treatments, yes, we are dealing with a situation where we have to live differently. But I suppose my point is if we can live a little bit differently and keep it suppressed, then hopefully we won't, it won't impact too much on any one individual over the coming months.
Okay, thank you.
Thanks.